churches in this county have a reputation of being extremely charitable. All the organizations we support, our churches, our funding agencies for the needy, even when people have a house burned down and it appears on television, there's an outpouring of help for those people from our community. So the desire, the characteristic of charity for this county and our people is there. We really need this millage to solve those kinds of problems that you just saw reported on ABC. It seems something that should make us feel better doing. And a way to manifest that feeling, that good feeling of helping another, is to vote for that millage, because for a little money each year for 7 years, we can solve those problems that you've seen here on ABC. Now I have an interview with Yvonne Lewis from the Faith Incorporated, a Genesee County healthcare organization, the organization that would likely spearhead the implementation of the millage if passed by the voters. Also in this interview, we have State Senator Bob Emerson, a staunch supporter of the millage proposal. Bob Emerson has always been in the forefront of creating and supporting proposals that help the citizens of our community. Now, I've known Senator Emerson, I hate to tell you how long, 30, 35 years. And I've always been amazed and have developed the greatest respect and admiration for his commitment to helping the little guy. And that's what this is about. This is the little guy we're trying to help. And we know most people out there want to do that. And this is such a simple way to do this, to solve that major problem that you heard ABC talking about. Here's our interview with Yvonne Lewis and Bob Emerson. Can you play that, please?
With a couple of old friends of mine, Yvonne Lewis, who is head of the program, an executive director of the Faith program, and we'll talk about that in a moment, and Senator Bob Emerson, who I've known for 35 years, an old friend of mine, and always said I thought he was the best senator down there, and I still feel that way. And anyway, we want to talk about the Genesee County Healthcare Service Millage that comes up in November, which is only a couple of weeks away from here, and what that's all about and how it fits into other plans, the state plan, the federal plan, and what have you, and what this millage will be used for. And I'm sure there's a little bit of confusion, as we've said in the past, there's been a lot of millages passed, but I've said on my program, I thought this was the most important millage of all, this one right here. Of all the millages we've asked for, obviously the paramedic is an important millage, but and I still think it's something we should have had. But this is where it is, to helping people who don't have any health insurance. Yvonne, tell us what the Faith program is that you're executive director of.
Thank you. Faith Access to Community Economic Development. We're a community-based nonprofit organization that focuses in on primarily engaging the faith community to help us access the community at large. And so we've been organized since 1992, and we've made with one of the early executive directors, Reverend A.C. Lee, who really helped us to get started in this work after the organization was formed under the leadership of the concerned pastors, primarily to be a separate nonprofit organization that would provide a mechanism through which to develop and implement programs that would specifically address some of the identified needs in the community. And this health plan happens to be one of those where we really see people on an ongoing basis who need the benefit of coverage that this would provide.
And tell us what it will provide.
Well, interestingly enough, we had a conversation with some folks earlier, and it's not an insurance program package, full coverage, but it provides certain benefits. One of the most important things in this community we know is individuals need to have a primary care physician. And that's one of the most important things so that their care can be ongoing. So we're looking at the opportunity for a primary care physician. There are x-rays that are covered under this program, some disease management, particularly in the case of this community where we have a significant number of people who have diabetes and needs that care management over time. And so then there's also a pharmaceutical component where there's some prescription medications that are taken care of as well with a very, very minimal co-payment for these services.
Now, none of these programs that you're talking about, or problems that people have, are really covered now, are they?
For those individuals who do not have insurance at all, no. I mean, we've got a number of people who regularly use the emergency rooms for their primary care. And so by the time they get to those services, by the time they go to the emergency room, there are a lot of needs that could have been met prior to that experience.
And I know that an emergency room, when you go in,